Hello, my name is Joe Imhoff, and this is my nutritional case study based on a fictional male for nutrition and wellness. Let's get into it. So, my case study is on a gentleman named Julian Peterson. He is a 70-year-old white male. He was an electrician for 40 years, and he is shockingly fit for his age. He's been retired for the last 5 years, and he mostly stays at home as he lives an hour from town and is somewhat in a depressive state that will be explained later. He lives on a small farm that him and his wife cultivated many years ago. A brief medical history on my patient. He is a diagnosed type 2 diabetic, and he was diagnosed 2 years ago at the age of 68. Until recently, he's had undiagnosed hypertension due to a daily reading on a blood pressure monitor with consistent values of 130 over 80. My role as a care provider for my patient, given my patient's somewhat depressive state and distance from town, I will travel to provide care for my patient every day. My role for him will include the following: preparing nutritious meals for him throughout his week, educating my patient on the benefits of his meal plan, and that staying consistent on it will help alleviate symptoms of both of his conditions, and then taking vitals on my patient and additionally drawing laboratory values to bring back to the lab when I go back to the hospital to assist with physician diagnoses, and then helping his registered dietitian create a better meal plan for him as this is an ongoing treatment. The demographics of Mr. Peterson is that he was 70 years old and he was born on April 9th, 1956. He's a male. He is 6'2", 6 foot 2 inches. He weighs 210 pounds. And given his size and height, he has a BMI of 27, which categorizes him as overweight. With his physical condition, he is ambulatory and maintains somewhat of a muscular figure from doing chores around his farm, despite being considered overweight. His social and economic status, he's retired as he mostly draws most of his money from Social Security, given his age. He lives an hour from town in any direction, and there's only one in his household. This is kind of due, and his wife passed away 6 months ago, and what children he has are in different states. This kind of aids in his depressive state and his lack of want to leave his home, just given that there's not much family structure in Mr. Peterson's life, so he just mostly stays to the confines of his own home. As for Mr. Peterson's sustenance, Mr. Peterson has been surviving off his garden and meat from his freezer for the last 6 months since his wife has died, not making many trips to town. As for Mr. Peterson's medical care, he has some access to some home monitoring equipment, including a at-home glucometer and an automatic blood pressure machine. 2 known conditions, one diagnosed and the other one that I had to assist with diagnosing was his type 2 diabetes and his hypertension. As for Mr. Peterson's type 2 diabetes, it was diagnosed 2 years ago by a physician while doing regular checkups with his wife at a doctor's office. He was diagnosed with this due to his fasting plasma glucose being 136 to 140 milligrams per milliliter after 2 separate tests administered to Mr. Peterson. Mr. Peterson has been treating his type 2 diabetes through his doctor-prescribed diabetes medication that typically comes in the mail form. Upon making first contact with Mr. Peterson, when I first started seeing him, he had stated to me that he had continuous high blood pressure values using his automatic monitor. I asked Mr. Peterson if he had any previous instances or history that were related to his high blood pressure values before I attempted a manual auscultation using a sphygmomanometer, and Mr. Peterson stated that he felt at times dizzy and saw stars in his vision. I eventually convinced him to come with me to get a checkup with a physician, and Mr. Peterson was diagnosed with stage 2 hypertension due to continuous readings of greater than or equal to 140 milligrams of mercury systolic, and then greater than or equal to 90 diastolic values on Mr. Peterson. After his checkup, Mr. Peterson was prescribed with a high blood pressure medication in order to treat the acute effects of his stage 2 hypertension. So these are for Mr. Peterson's current medications and potential interactions. So for his type 2 diabetes, Mr. Peterson was prescribed a DPP-4 in his Januvia. And this helps prevent the breakdown of his GLP-1 and then increase his insulin secretions to lower his blood glucose level. As for potential interactions with his Januvia, there's not a ton of interactions that will interact with this drug. However, there are more dietary interactions that could interact with it. Mostly just kind of a lot of the same steps that a lot of type 2 diabetics follow. Avoiding sugary foods, avoiding alcohol, and many other foods that might spike blood glucose level and reduce the overall efficiency of DPP-4 medications, just like Reese's Pieces, sugary candies, stuff like that. For his hypertension, Mr. Peterson was prescribed an ACE inhibitor, kind of cover everything for him, with that being enalapril. This way it prevents the buildup of a chemical in his body that narrows his blood vessels. There's a bunch of potential interactions with this. NSAIDs, such as like aspirin, can reduce the overall effectiveness of ACE inhibitors and may raise his blood pressure with a chance to damage his kidneys. If he was prescribed ARBs, these interactions with ACE inhibitors can raise potassium levels and lead to kidney damage. If he is prescribed a diuretic pill, this can have negative interactions with ACE inhibitors and cause kidney damage. And then the biggest thing that he needs to avoid is avoiding a diet high in potassium and sodium, as both can produce a dangerous condition of hypokalemia, which can influence the direction of water in and out of the cells and potentially to edema and a bunch of other issues for Mr. Peterson. Upon first making contact with Mr. Peterson, he stated that the mentioned diet that is on this page is very similar to what he eats on a daily basis, and this is what I recorded. For breakfast, he had 4 pieces of bacon with 2 pancakes with 1 teaspoon of butter and half a cup of syrup. For lunch, 2 half-pound burgers served on 2 different buns, 2 tablespoons of mayo, 1 tablespoon per burger, and then 1 tablespoon of ketchup, half a tablespoon for each burger, with a 3-ounce side of French fries, and he generally has a can of soda with that. For dinner, he had a half-pound ribeye steak with 3 cups of mashed potatoes, with 1 teaspoon butter, with 3 cups of a side salad, typically with a lettuce mix and romaine lettuce, drenched in 4 tablespoons of Hidden Valley Ranch. Daily intake calculations of this is over 3,000 calories. Carbohydrates are 313 grams, fat 202 grams, and then protein 149 grams. Additional considerations that he does drink alcohol every few days, but he's not a regular drinker, but it does contribute to varying calories throughout his daily diets. Comparison of daily food intake to recommended nutrition values. He consumes roughly about 1,000 calories more than he does need using a USDA DRI calculator. His carbohydrates are within recommended limits using the USDA DRI calculator. However, given his type 2 diabetes, his carbohydrate intake should be lower to prevent blood sugar spikes. His fats are more than double what the USDA DRI calculator is, and he's mostly getting these from saturated sources, such as a lot of that butter and that syrup. So something that we needed to take into consideration with a new diet for Mr. Peterson, and his fat intake is far too much for both of his conditions and should be monitored. As for protein intake for him, he's about, again, double his recommended protein intake given his age for the US DRI calculator. This is also something to be considered given his protein intake. With his type 2 diabetes, it could potentially have negative interactions with his kidneys and cause kidney damage. And then here are some other areas of concern in relation to his diet. His sodium, he consumes about 5,000 milligrams of sodium per day. This value is almost more than twice his recommended MyFitnessTracker recommended value, and 3 times the recommended 1,500 milligrams of sodium for those with stage 2 hypertension. Potassium, his potassium is 148 milligrams higher than his daily recommended limit. As previously stated, for both conditions, this can raise him into a potentially dangerous hyperkalemic situation and cause potential kidney damage and other factors. And then both an excessive amount of calories and fats. The fats contribute to his hypertension substantially, given that they're from saturated sources, and the excessive amount of calories contributes to Mr. Peterson's obesity. So this is the meal plan that me and the registered dietitian came up with to address his current issues. For breakfast, Mr. Peterson is now having 4 scrambled eggs with 1 cup of applesauce, 2 pieces of whole wheat toast. Lunch, he's having 1 chicken breast with 2 cups of green beans, and then for dinner he's having 2 grilled salmon with 2 cups of steamed rice. This addresses Mr. Peterson's high potassium and sodium levels to assist with preventing kidney damage and hyperkalemia. His fats are far more under control now, with significant reduction in saturated fats found in his previous diet. He's getting all the fat he needs out of mostly from the salmon, and then a significant caloric decrease, about 1,000 caloric difference between that and his old diet. And this assists with helping him lose weight. And then he's decided to give up drinking alcohol in order to better treat both of his conditions. And yeah, that's how it should help Mr. Peterson. This was my nutritional study, and thank you for listening.